Assalamu Alaikum everyone. My name is Sayyida Hiba Bukhari. Welcome to my channel The Med Corner, and today the topic of our conversation is skin and fascia. So we are going to be discussing about that what is skin, what is fascia, what are the layer of skin, what are the appendages of skin, and what is the advantage of having skin and fascia in our body. So let's discuss about these one by one in this video today. As you all know that the skin is the largest organ of our body which covers the entire body from head to the toe. The skin is divided into two parts, the epidermis and the dermis. The epi word suggests that it is something which is located on the outer side or the upper surface. So the epidermis is the superficial part of the skin, while the dermis is the deep part of the skin. And if we talk about the histology of the epidermis, so the epidermis is a stratified epithelium with the cell that flatten as they mature. As you guys can see that on the palm of your hand and the sole of your feet, the skin is very hard. So the epidermis is extremely thick in these regions that are the sole of your foot and the palm of your hand, because in order to withstand the wear and the tear that occur in these regions. While in some region of the body the skin is found thin, like if you take a look over the skin of your arm and the forearm, so the skin epidermis over there is very thin as compared to the sole of your feet and the palm of your hands. Now if we talk about the histology of the dermis, so the dermis is composed of the dense connective tissue containing many blood vessel, lymphatic vessel and the nerve, while the epidermis is free from the blood supply and free from the innervations. So you should be wondering about how the epidermis is getting the nourishment from the body while it doesn't have the blood vessels in it. So the answer to this question is that the deepest cell of the epidermis are connected with the dermis, so they get the nourishment from the dermis by the process of diffusion. It is a very important question often asked by the teacher, so you should remember it. Beneath the dermis, there is a third layer of skin which is called as a hypodermis, which constitute of the subcutaneous tissue. And beneath the hypodermis, there are the attachment of the muscles and the bones. In order to make it more clear and more easy for you guys, let's take a look over the diagram. As you guys can see, the skin is composed of the superficial layer which is epidermis, which is avascular in nature, and the second layer is the dermis, which is vascular in nature, having the blood supply, having the nourishment. The third layer is the hypodermis, which consists of the subcutaneous tissue, and beneath the hypodermis there is the muscle, and beneath the muscle there would be the bone. Now let's talk about the appendages of a skin, which include the nail, the hair follicle, the sebaceous gland and the sweat gland. So what is a nail? The nail are the keratinized plate on the dorsal surface of the tip of the fingers and the toes. Now you should be wondering that what is the keratinized plate. So keratin is a protein which is found at the nails, which protect the nails by making them strong and resilient. It would be easy to understand the anatomy of a nail with the help of a diagram. As you guys can see that the proximal edge of the nail is called as a nail root, while the distal end of the nail is called as the free edge of the nail. The root of the nail is overlapped by a fold of skin which is called as a nail fold. The surface of the skin which is covered by the nail is called as a nail bed, which is highlighted in the dark red color over here, while the nail bed is covered with the body of nail. The epithelium lining the nail fold is called as the aponechium, that is above the nail bed, while the hyponechium is below the nail bed. Now if we take a superior view over the nail, you guys can see at the distal end there is a free edge of the nail. Then beneath it there is a whole area which is called as a body of nail. There are the lateral nail fold on the lateral side of the nail, while the proximal nail fold is covered with a lunula. The lunula is a word referring to the half moon, as you guys can see that the white crescent shape area over the skin, which is considered as a half moon. Now let's talk about the second appendage of skin, which are the hair. So the hair grow out of the follicle, which are the invagination of the epidermis into the dermis. The follicle lie obliquely to the skin surface, and their expanded extremities is called as a hair bulb, which is located deep into the dermis. As you guys can see that the hair bulb is concave below, so the concavity of the hair bulb is called as a hair papillae. The hair papillae has the invagination of an artery and the vein which provide nourishment to the hair. A band of smooth muscle, the erector pili, are also present in the dermis connected with the hair follicle. The muscle is innervated by the sympathetic nerve fiber and its contraction causes the hair to move into a vertical direction. The pull of this muscle also causes dimpling of the skin surface, so it is called as a goose flash or the goose pimples. So that's all about the anatomy of the hairs. Now, if we talk about the presence of the hairs, so the hairs are distributed all over the body except a few regions, which include the sole of the feet, the palm of the hand, the lips, the glans penis, the clitoris, the labia minora, and the internal surface of the labia majora. So these are the areas where the hair are not present. Now let's talk about the third appendage of skin, which are the sebaceous glands. So the sebaceous glands secrete the sebum onto the shaft of the hair. The location of the sebaceous gland is near the hair follicle but within the dermis. Now you should be wondering that what is sebum itself. So the sebum is an oily material or the oil which is secreted by the sebaceous gland in order to lubricate the skin, in order to avoid the water loss from the surface of the skin in case of dehydration in the body, and it also protects the skin from the infection of the bacteria and the fungi. Now moving toward the last appendage of skin, which are the sweat glands. So the sweat gland are the long spiral tubular gland in structure which are distributed all over the surface of body except on the red margin of the lips, the nail bed, the glans penis and the clitoris. These glands are penetrated deep into the dermis near the surface of the superficial fascia. So the sweat gland are therefore the most deeply penetrating structure of all the epidermal appendages, which is an important point for the BCQs. So this is all about the basic anatomy related to the skin. Now moving toward the second part of the video, which is the fascia. Now, what is a fascia? So, a fascia is a connective tissue that encloses the body deep to the skin and also envelop and separate the individual muscle and a group of muscle as well as the deeper organ. As now it is understood by everyone that the skin is the most superficial organ of the body, which is covering the entire superficial surface of the body. Beneath it, we found a layer of the subcutaneous fat, and then we found the fascia, which is a connective tissue that holds the structure of body in an organized manner. The fascia of the body can be divided into two types, the superficial fascia and the deep fascia. Now let's discuss about that what is a superficial fascia. The superficial fascia is often called as a subcutaneous tissue, is a mixture of loose areolar and the adipose tissue that unite the dermis of skin to the underlying deep fascia. While the deep fascia, often called as a muscular fascia or the visceral fascia, is a membranous layer of connective tissue that invests the muscle and the other deep structure of the body. So that's all for today. I hope you guys like the video, and if you do so, then make sure to like and subscribe to the Medcorner. See you in the next video. Take care. Bye bye. Allah Hafiz.